Testing.
It's okay. You can bring it closer to you.
Participants on the call, including you.
Good morning, everyone.
Good morning. Morning. Denisha, whenever you're, ready, would you, call the roll before we start?
I will.
Okay, whenever the time's right.
Okay. We have about 3 more minutes. And just to let you know, we do have an,
It's needed.
okay, I'll do that as well.
Good. Well, I had some other, wait, I'm sorry, who was that? Norm Boyd. No, I mean, it made the trip in from America. I know, I met there, apparently he failed us from getting to America until a couple weeks later.
Maybe we need to let Russ vote twice on anything we vote on.
That's right. I think so.
Well, you all missed it because there's a huge bonus for anybody that showed up today. But we're not going to tell you what it is. Mr. Childers and I are eating all of your candy that was laid out on the table. Let's see what our time is. We've got 1 more minute now. Almost set. And we're good. Okay.
Chairman Boyd, we're ready to begin.
Want to do the intro?
Okay, if you'd call the roll, please.
Yes, sir. If anyone needs the services of our hearing impaired interpreter, you may take your seat. I'll now go through the official roll call. Chairman Norman Boyd,
Here.
Elena Cummings,
Here.
Roger Folsom,
Here.
Anthony Williamson,
Here.
Mark Trail,
Here.
David Cruz,
Good morning, I'm here.
Russ Childers,
Here.
Russell Crutchfield,
Present.
Kenneth Davis.
Here.
Thank you.
Thank you, Denisha. Welcome to everyone. Thanks for joining our call this morning. We have a rather brief agenda, and we'll call the meeting to order. We do have a quorum of all of our board members are present. One present on site, and the rest of us on the phone. So, if you're making a motion today, please identify yourself so that we get the proper name into the minutes of the meeting. First thing on our agenda this morning is the minutes of the previous meeting, February 13th meeting last month. And I'll ask Elena Cummings, our secretary, if she has read the minutes and would recommend approval.
Thank you, Chairman Boyd. I have reviewed the minutes from the February 13th meeting and find them to be in order as written and would make a motion to approve.
Is there a second to that motion?
Second the motion, Mr. Chairman, Roger Folsom.
Okay, thank you, Roger. The motion has been made for approval of the previous meeting's minutes. And the seconded, all in favor say aye. 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 Opposed? Abstaining? Hearing none, they are approved. Thank you, Elena. Next on our agenda, I'll turn it over to Commissioner Berry for his report.
Good morning, Mr. Chairman, members of the board. Thank you very much. I will be brief, but I did want to just spend a minute or two giving you an update on the department's role as it relates to emergency preparedness for the virus that we are all experiencing across the state, country, and world. We have implemented our emergency preparedness calls that are occurring every morning for the foreseeable future, including weekends at 8:30, where we have representation from each one of our divisions. Number one priority, of course, is to make sure that all of the people in our care are getting the best care that they can possibly get through our network of providers. Second to that is making certain that we have reduced as much administrative burden as we possibly can so that providers and members can have easy access to both care and reimbursements. So we are implementing some of those strategies now. The other thing that we have done is assigned a team member to be available when needed to the Emergency Preparedness Center that will be run by the state of Georgia as we move forward. And that will be to help with calls and things like that. We also have additional resources that, if needed, can be deployed to the call center based on what the Department of Public Health and the governor's office would need. They certainly are taking the lead on this, public health particularly, and Dr. Toomey has done a remarkable job of keeping us informed. We're in daily contact with them. So I just wanted to make certain that the board knew that we were actively participating and doing everything from a proactive standpoint to make certain that first and foremost, the people that rely on our services either through SHBP or through Medicaid are getting those services, and two, if they're a provider, and making certain that they're getting paid in a timely way and that we are reducing the administrative burden so that they won't have to jump through so many hoops in order to get either medication prescription refills or authorizations for services. So I'll continue to keep the board informed, but please feel free to reach out to me or as you all now know, I think any of our division leads or assistants if you need further information, but I can certainly answer any questions that anybody may have.
Questions or comments for the commissioner, please? Commissioner, on behalf of the board, I think I can echo our feelings that we appreciate very much the efforts and the role that you and your folks are playing in this emergency that we find ourselves in, and appreciate the extra efforts that are taking place, and confident that our people are playing their roles as we would expect. So thank you for that.
Thank you. I'll pass that along to the team. Thank you very much.
If there are any other questions or comments for the commissioner? We have only one agenda item this morning, and that's the primary reason. It is the reason why we're having a phone call conference this morning is because of the agenda only contains one item that is up for final adoption. And we'll ask our third-party liability director to make a presentation on the rules and regulations for estate recovery. And that was presented to us and gone out for initial adoption, and we will be asked to vote on this for final after the presentation. So you may proceed.
Good morning, Mr. Chairman, Commissioner, board members, and our public. The Office of Inspector General, Third Party Liability Unit, is presenting the Estate Recovery Rules 111-3-8 for final adoption. For background, the official code of Georgia annotated 49-4-147.1 authorizes the commissioner to waive the first $25,000 of an estate under the Medicaid Assistance Plan for Estate Recovery under Title 19 of the Social Security Act. The Georgia State Plan was updated to reflect the following language. To prevent substantial and unreasonable hardship, the commissioner shall waive any claim against the first $25,000 of an estate. The above language was approved by the Centers for Medicare and Medicaid Services Division of Medicaid and Children's in Health Operations on August 23, 2018, and became effective July 1, 2018. Accordingly, Georgia Comp Rules and Regs 111-38 requires the following updates. Authority for the commissioner to waive the first $25,000 of any estate, clarification and correction to other subparts of Georgia Comp Rules reflecting process improvements, and language permitting the department to maintain compliance with 42 USC Section 1396P. Public comments, there was an opportunity for public comment, was held on February 11th, 2020. Written comments were due on or before February 14th, 2020. There were no oral comments received. There were no written comments received. Accordingly, the Office of Inspector General recommends and is requesting consideration for final adoption of Estate Recovery Rules, Chapter 111-3-8. Any questions? Thank you.
Mr. Chairman.
Questions or comments?
Yes, Mr. Chairman, this is Mark Trail. I do have one quick question. Are we actually collecting much of anything from estate recovery?
Yes, collections are usually a little bit under $5 million.
Annually?
Yes,
Okay, that's more significant than I thought. Thank you.
yes, thank you.
Any other questions or comments? Is there a motion for approval for final adoption?
So moved.
I'm sorry, who made the motion?
That was Russ.
Okay, Russ, is there a second?
Trail will second.
And Mark Trail has seconded the motion for approval for final adoption. All in favor, say aye.
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 Aye. Opposed? Abstaining? Hearing none, it is approved, and thank you very much.
Thank you.
Does anyone know of any new business or needs to come before the board at this time? Hearing none, I would remind you that our next meeting we would expect to have on site there on April the 9th at 10:30 a.m. And with that, I will call the meeting adjournment, and hope that we all stay healthy and safe during this time period, and look forward to seeing everyone next month. Thank you.
Thank you.
Thank you.